Once again, I wish to thank you for honoring our invitation. I want to particularly appreciate your support in educating Nigerians about the misleading theories around anti-vaccination elements that have been crafted to discourage people from seeking protection against COVID-19. Although it is increasingly evident from independent voices that the conspiracy theories are fake and misleading, we need to remain on the alert and continue to provide Nigerians with factual information to enable them see the need to get vaccinated against COVID-19. We must follow all guidance, information, and make sure that the information vacuum that mischief makers will take advantage of are closed rapidly. It is with the support of our mainstream media that Nigeria has successfully vaccinated 3,938,945 eligible persons across 36 states and the FCT. This represents about 98% utilization of the 4,024,000 doses of the Oxford AstraZeneca vaccine that we received from the COVAX facility in March of 2021. This comprises 2,534,205 people who have been vaccinated with the first dose and 1,404,205 people who have received their second dose of the vaccine. In the course of this exercise, the country recorded 14,550 cases of mild to moderate adverse events following immunization, with only 148 cases considered to be severe. However, we did not record any case of deaths directly associated with COVID-19 vaccination. Accordingly, the country has officially ended the first phase of a strategic COVID-19 vaccination plan and is now preparing to commence the second phase in the next few weeks. We have also received communication about the delivery of the following vaccine shipments in the coming weeks. Firstly, 3,924,000 doses of the Oxford AstraZeneca by the end of July or early August 2021 from the COVAX facility. Secondly, 3,930,910 doses of the Pfizer-BioNTech or Moderna COVID-19 vaccine in August from the COVAX facility. This has been donated by the United States government. Thirdly, 3,577,860 doses of the Pfizer-BioNTech or Moderna COVID-19 vaccine in Q3 from the COVAX facility. Fourthly, 29,850,000 doses of the Johnson & Johnson COVID-19 vaccine procured by the federal government through the African Union. We are making effort and are confident that with your continued support, Nigeria will be able to make significant progress in the utilization of the vaccines that are going to be supplied to the country. As you may be aware, in the first phase of the vaccination program, no vaccines expired, despite a lot of concern that as a result of vaccine hesitancy, many Nigerians may not be vaccinated. But because of the collaboration and the leadership that the media has shown, a lot of Nigerians came forward despite all of the negative conspiracy theories, and accepted the vaccines. This is why we're able to ramp up and finish the vaccines, and we did not have any vaccines expire. As a matter of fact, we do have a batch of the vaccine that was set to expire by July 29th. But you can see how far off from July 29th we are, and as of Friday last week, we already finished the vaccination of Nigerians for the first phase. We now have a lot of Nigerians that are calling and asking for vaccines. As I read earlier, we're expecting vaccines in the next few weeks, and we will be able to address those needs. Furthermore, the National Primary Healthcare Development Agency is putting in place the necessary logistics for storage, distribution, security, and accountability for the range of vaccines that we're expecting. To this end, the federal government has procured 60 units of the ultra cold chain equipment, and as we speak, about 37 of these have been deployed to 36 states and the Federal Capital Territory in preparation to receive all the COVID-19 vaccines that will require ultra cold chain temperature below 40 to 85 degrees Celsius. It is important to stress that anyone who is 18 years and above is eligible to take the COVID-19 vaccine. This includes pregnant and lactating women. I therefore call on every eligible person to register and make themselves available for the vaccination in due course. Furthermore, with the leadership of eminent Nigerians, the Federal Ministry of Health and its agencies are continuing the process of supporting our local partner, BioVaccines Nigeria Limited, towards establishing local vaccine production. With the detection of the Delta variant of COVID-19 in Nigeria, it is important that Nigerians continue to observe non-pharmaceutical or public health measures, such as wearing of face masks, social distancing, and hand hygiene in order to curb transmission of the disease, while we await additional doses of the COVID-19 vaccines. I thank you for listening and now cede the floor to the WHO country representative and the UNICEF country representative in that order. Your Excellency.
Exercise, and which has attracted commendation from the whole region, even the world. Indeed, Nigeria has shown that administering vaccine at a large scale, COVID-19 vaccine at a large scale, is indeed doable. And many are learning from Nigerian experience on how to address issues when it comes to rolling out COVID-19 vaccine. So congratulations indeed. However, we must remind ourselves that the world remains at a perilous point in the pandemic. Variants are currently winning the race against vaccine because of inequitable vaccine production and distribution, which also threaten the global economic recovery. I do not wish to sound alarmist by saying that last week, Africa marked the continent's most dire week of COVID-19 pandemic. But we all know that the worst is yet to come, with the third wave continuing to escalate and 15 countries now in resurgence. Nigeria may not meet the criteria for resurgence, at least for now. But with the recent increase in new cases and report of the highly transmittable Delta variant, we are monitoring them closely. However, the need exists to stress that the Delta variant is dangerous and is continuing to evolve and mutate, which require constant evaluation and careful adjustment of the public health response. With Nigerians' antecedent during the first and second wave, I'm very confident that we can still blunt the impact of these new infections if everyone, everywhere, plays their part by taking precautions to prevent the transmission. While global vaccination rates remain low, there is hope. Vaccine delivery through the COVAX facility are picking up speed, and we are working around the clock to clinch those sharing pledges and procurement deals with manufacturers to rapidly secure vaccine for most of the African countries. But before that happens, we will count on your social responsibility as media personnel to debunk misinformation about the vaccine, to create awareness given to the increased risk of resurgence by urging Nigerians to be on high alert and maintain a heightened state of readiness for a possible resurgence, keeping in mind that each wave tends to last about 6 to 8 weeks. We must be mindful of discontinuing public health and social measures. Lifting them too early could see us losing some of the gain that the vaccine have enabled us to make. On our part, WHO will support Nigeria to maintain strong surveillance and detection system, reassess and bolster treatment capacity, and advocate for stepping up the supply of critical medicine, including medical oxygen, for the treatment of severely ill patients. We know there are a number of new developments, but we will continue to work alongside NPACDA, the Presidential Steering Committee on COVID-19, my colleague from UNICEF and other UN agencies to support Nigeria as best as we can. We know that there are development on interchangeability, combination of different vaccines. We continue to monitor evidence and will advise the Nigerian government when that evidence has been validated and put into guidelines. But for now, we still advocate for Nigeria to follow the same guidelines that were provided before, using the same vaccine for the first and the second dose, or using the same vaccine when it's a single dose, until such time that WHO will have validated the other option. There are a number of concerns about the vaccine passport in some of the EU member countries. I would like to reassure the press that WHO does not support any requirement for proof of vaccination to travel. This is because we are still in the curve of inequity. We need to ensure that all the countries, all the continents are adequately covered before issuing such a recommendation. However, we are also in discussion with the EU member state through the European Medicine Agency to find a solution. And I would like to re-emphasize that it's just a matter of administrative purpose. It has nothing to do with the efficacy of the AstraZeneca vaccine received through Serum Institute of India. It's just a matter of bureaucratic processes where the institute was expected to also submit a request for approval through the EMA. So it's very important that, as a member of the press, you also spread the same news. There is no such thing as substandard vaccine for African and high standard vaccine for the rest of the world. Thank you very much for your attention.
Abuja Airport, waiting for the plane that delivered 3.294 million doses of Oxford AstraZeneca vaccine for Nigeria. At that stage, none of us thought that by last Friday, all the vaccines would be used. All 36 states plus the FCT reported that all vaccines were utilized. It's an incredible achievement. But should we have been surprised? The network that Nigeria has around vaccination, using it for routine immunization, using it for polio, measles campaigns, and other preventable vaccinations for diseases. The integration of COVID-19 has been a seamless and yet a successful integration into our vaccine program in Nigeria. And I want to congratulate your leadership, Executive Director of MPCDHA, in this endeavor. What were the factors that contributed to this? First and foremost, the fact that the decentralized nature of governance and service delivery in Nigeria allowed for 36 states plus the FCT to be able to vaccinate simultaneously. Second, that the decision-making was derived on data-driven decision-making. And every day, different data was analyzed and used to make the decisions where best to administer the vaccine and how to move vaccine around for maximum utility. But also the fact that the government of Nigeria and the Ministry of Health were able to use the vaccine most flexibly wherever it was most needed, where it was most used around the country. In the end, as the Executive Director has quite rightly pointed out, just under 4 million people have been vaccinated. 1.404 million people have received the double vaccination, and we look forward to the remaining 1.4 million receiving their second dose as soon as is possible. This is a great achievement. But as we have all said, the pandemic is still here, and we must take measures to ensure that we prevent its further expansion around the country, but also we take the measures to ensure that the next phase of the vaccination campaign is equally successful. As Nigeria stands up in the rest of Africa and in the world as a leader on this vaccination, we must prepare through good social mobilization, through the traditional and religious leaders, through community leaders, to ensure that all people understand the criticality of taking the vaccine and the low risk that it has for it. In the meantime, the preventative non-pharmaceutical measures must be taken, the wearing of masks, the washing of hands, and the socially distancing. I want to end a plea to all people in Nigeria. When the vaccine is available, please demand to be able to take it. It is there for you to take your social responsibility, to protect yourselves and to protect your communities and your families. This is a vaccine and a pandemic that won't go away for the time being unless we take the vaccine seriously and use it promptly. The international community to provide the necessary vaccine. Nigeria has demonstrated its effectiveness in the use of vaccine. Let's build on that success and provide it with the necessary vaccine in a timely and equitable way so that all Nigerians can be vaccinated by the end of 2022. Thank you very much.
The first set of questions was from Friday. They asked how potent the AstraZeneca vaccine is against the Delta variant of COVID-19 vaccine. The AstraZeneca vaccine that we've used in Nigeria has been shown to be at least 88% effective against the Delta variant. So far, what the studies have shown is that the Delta variant has very minimal vaccine escape properties against the AstraZeneca vaccine. So we're still in a good place in terms of effectiveness of the vaccine that we used against the Delta variant. This, however, does not mean that because we've taken 2 doses of the AstraZeneca vaccine, all bets are off. It means we can go to town without our face masks, without observing social distancing or hand hygiene. We still need all of those non-pharmaceutical measures to protect ourselves and our loved ones from the COVID-19 vaccine. Again, we've been very clear about the fact that the evidence that we have is that the vaccines protect against severe disease, against hospitalization and mortality. However, even with the vaccination, it is possible to have a mild form of the disease, right? And it is still possible for you to transmit the virus. This is why it is important for us to continue to wear our face masks practice social distancing and do hand hygiene, right? While we continue to gather more information about the nature of these vaccines that we're using for the very first time. Can we change this microphone? I think it's... So I believe the second question was whether, because of the Delta variant, we will need a third booster dose for the AstraZeneca vaccine for those who have already taken 2 doses. This is not the recommendation right now. Like I mentioned earlier, having as much of at least 88% effectiveness against the Delta variant is good enough for Nigerians who have taken the vaccines to be protected against this variant. Then the third question is whether it is possible to mix and match the vaccines. So for somebody who has taken the first dose of the AstraZeneca vaccine, whether they can now take up the Pfizer or any other vaccine. This, again, is not the recommendation. If you take the first dose as AstraZeneca, you should take the second dose as AstraZeneca. There isn't enough evidence to show that you get the same protection when you use 2 different vaccines. I know that you might have read in the papers that one of the leaders from the European countries, I think specifically it was Chancellor Angela Merkel of Germany, that took 2 different vaccines. We are not very clear. We don't have information as to why that was required. Okay, and so it is not in mainstream science, mainstream public health practice allowable. Maybe there were specific reasons why that isolated incident took place, but generally, if you take one vaccine as first dose, you should take the second exactly the same vaccine as the second dose. Then there was a fourth questions about the rumors that vaccines were withdrawn from the states because they were expiring and then they were kept. This is not correct. There is no vaccine that expired in Nigeria. Like I mentioned during my speech, we still had a lot of headroom in terms of expiry dates for the vaccines. We had vaccines that were W.H.O expire on the 29th of July, but we utilized them way ahead of the expiry date. If there are questions about why vaccines were withdrawn from a couple of states, well, there were some states that had a very large adoptive capacity and they had populations that wanted additional doses. Again, part of the reason for the success of our COVID-19 rollout program in Nigeria is the fact that we use data, right? So we were able to look at the data, looked at the absorption, looked at the rollout capacities across the state, and we were able to manage our stock balances to make sure that not only was there equity, but also looked at the epidemiology of the virus. So for example, because we know Lagos State is the epicenter of the epidemic in Nigeria, we made sure that Lagos State also got the highest quantities of vaccines, right? So it wasn't a matter of sharing the vaccine equally across the states. We looked at the data, we looked at the epidemiology, and made sure that those states, those local governments that were more likely to have an outbreak of the disease eventually had a little bit more of the vaccines. No vaccine expired in Nigeria. If there are questions about perhaps the number of vaccines that were donated to Nigeria and the exact number of people that were vaccinated, it is normal practice within the immunization space that as you vaccinate, you have a specific quantum of vaccines that are usually tagged as wastages, right? Because it cannot be perfect that you have 4 million doses of vaccines and you actually immunize exactly 4 million. That is not possible. So if those are the numbers that you are looking at, that is the explanation for that disparity in the numbers. Then the final question was whether there was a third wave already in Nigeria. So we already can see increasing cases in the country, especially in Lagos. These are signs of an impending third wave. But whether we will go into a full-fledged third wave is wholly dependent on how we manage these initial signs. How are we able to rise up as a country and observe the non-pharmaceutical interventions, making sure that outside of our homes, in indoor settings where there are people, we wear face masks, we observe social distancing, we continue our hand hygiene. You know, up until a few weeks ago, people went about their businesses feeling like, oh, COVID-19 is gone, right? Despite what we saw in India. We're also approaching a period of festivity, right? The Eid al-Kabir celebration. What the numbers are showing us is that we have to be very careful that we don't go all out and mingle in crowds and refuse to take those public health measures. If we do that, it means that we are welcoming the third wave. Similar circumstances occurred in India. Part of the reason why they witnessed the third wave was because of the festivities in India. There was a lot of traveling, there was a lot of crowding, and eventually, after a few weeks, they began to see the increases in the cases. So we can learn from the experience of India and be very careful during the Eid celebrations to observe the public health measures that have been laid down by the Presidential Steering Committee.